Brain Fog and Dizziness by dizzinessdoctor.com. Thank you. Thank you for your interest in dizzinessdoctor.com. If you are a person suffering from symptoms such as dizziness, imbalance, unsteadiness, disequilibrium, vertigo, etc., then our goal is for you to bring those symptoms under control. If you are a healthcare provider trying to help your patients manage those kinds of symptoms more effectively, then our goal is for you to understand better how to diagnose and treat the underlying disorder. Disclaimer. This material is intended for educational purposes only and does not substitute evaluation by a qualified healthcare professional. Accessing this material is subject to the terms and conditions detailed at dizzinessdoctor.com. Purpose of this presentation. The problem. I feel brain fog along with my dizziness. How can this be managed? The solution. We discussed that the poorly defined phenomenon of brain fog can occur in the context of many diagnoses, of which dizziness from any cause is merely one. Since there is no test for brain fog, and since the mechanism is unknown, and thus there is no proven therapy specifically targeting it, the most practical approach is to treat the other identifiable disorder. In other words, treat the underlying cause of the other symptom, whether dizziness or anything else. What is brain fog? Brain fog is not yet a formal medical term. Nevertheless, a PubMed search for this phrase yields over 1,000 hits, which is to say articles published in peer-reviewed journals, reflecting the fact that patients use this descriptor frequently. The topic of brain fog is difficult to study because the literature on this topic shows that there is no widely accepted definition, the mechanism of brain fog is unknown, and there is no objective test for brain fog. One approach to characterization. Atik and Inel Manav categorized various symptoms reported by patients complaining of brain fog. We will show these on the next slide. To be clear, this approach is merely a suggestion by those authors and should not by any means be interpreted as definitive or diagnostic. Symptoms reported with brain fog include many cognitive symptoms, physiological symptoms, and psychological symptoms. That approach is not diagnostically very useful. Each of the individual symptoms that Atik and Inelmanov list, reported by patients in association with brain fog, can have a broad range of causes, so these do not go very far in narrowing down the underlying mechanism of brain fog. Epidemiology. There are not yet any publications that have formally studied the epidemiology of brain fog. A reasonable, though very imperfect, proxy is that brain fog has been reported in association with many diseases, including neurological disorders, cardiovascular disorders, gastrointestinal and hepatobiliary disorders, endocrinological disorders, disorders of nutrition and metabolism, immune-mediated diseases, infectious disorders, psychiatric disorders, and others. Mechanism of disease. We have seen that there is no consensus on the definition of brain fog. The descriptions of brain fog are quite varied. Brain fog occurs in association with a range of other diagnosable conditions, and brain fog has no objective confirmatory test. Given the above factors, it is unsurprising that the underlying mechanism of brain fog has remained elusive. The absence of a clear mechanism of disease has made it difficult to treat brain fog. Treatment. Given those limitations, the most practical approach is that if a person with brain fog already carries some other formal medical diagnosis, then that other disease should be the initial therapeutic target. If a person with brain fog also complains of dizziness, then it is reasonable to try to determine the cause of the dizziness if possible, and treat it. It is unusual for a person to complain of brain fog in complete isolation of any other diseases. So if brain fog is the only reported symptom, then it is medically reasonable to undertake a search for other diagnosable conditions. This investigation is usually overseen by a patient's primary care physician. Prognosis. Insofar as brain fog may be associated with the presence of other diagnosable medical conditions, the prognosis depends on the degree to which those other conditions can be treated. Thank you. Thank you for viewing, reading, or listening to this material and for your interest in dizzinessdoctor.com. We welcome your feedback and support. The highest compliment you can give us is to refer our educational materials to others who could benefit from them.